Hi guys, welcome to my presentation on the interview assessment style approach. So what do interview assessments involve? They involve face-to-face contact with clients or their families. They provide an opportunity for clients to give you in-depth answers to more open-ended questions, and then it gives you the opportunity as a specialist to observe their behavior in that kind of a setting. So some suggestions for your interview: be consistent. Our text says that the protocol for administering an interview should include the words to be stated by the specialist. This includes establishing rapport, the introduction, transitions, probes, and closure. And then I've just written that this consistency increases your reliability and it reduces your chance of error in an assessment. Know your client's characteristics. Our text says gathering information through client interviews may not be the most reasonable course of action for all client groups. Essentially, this just means that you need to remember what type of client you're working with. If they have cognitive processing issues, an interview might not be the best idea. So just be aware of who they are, what their needs are, and then determine from there whether or not an interview is going to be the most appropriate course of action. So establish rapport and give an introduction. As a specialist, you want to take the time to introduce yourself to the family, to the client, obviously, and state the purpose of your interview. And then you want to kind of explain how the interview is going to go, what types of questions you're going to ask, and then how that information is going to be used for your programming purposes. So basically, you're just, going in there and making them feel comfortable with you and not in the dark about why or why not you're interviewing them. So just give them that information and that will build their rapport. Ask open-ended questions. Ask questions to which the client may have an extended answer. Questions should contain content that is parallel to program content. And we're going to see some examples of this on the next slide. Our text says to be aware that good open-ended questions are difficult to write, but worth the effort in terms of eliciting client response. So here's some examples of open-ended questions. Say I have a client with, depression or something along those lines, and I ask them, hey, what actions do you take to manage your stressors on a daily basis? And maybe they say, well, I do this and this and this, and they're basically giving me a follow-up on what I've asked them. Then from there, I ask them, okay, well, what's preventing you from fully enjoying this? What's preventing you from, doing the things that you need to be doing to manage your stressors? And then they're not just giving me a yes or no, they're giving me in-depth responses as to, what is preventing them? What is it that we need to be doing to fix things? So anyway, examples, just remember to ask open-ended questions. Use probes and restatements for clarification. Have specific questions prepared. This way, when the clients are unsure or unclear of their answers, the specialist can use prepared statements to clarify. Some examples here I have, what do you mean when you say? What else would you like to add here before we move on? Things like that. And then finally, we close our interview. The purpose of the interview closure is to summarize the interview and the information that has surfaced. So closure is re-emphasizing the results of that interview, and then as you close, you can reiterate what services you offer as a TR and how we can help, and then remember to thank the client or the family for their time.